Good afternoon, everyone. My name is Dr. Jeanette Lopez Bellin, and today we're going to be talking about Measles 101 in just 10 minutes. So let's just wait a little bit for more people to join today. We're going to be talking today about the data in general, including United States, including Texas and Orange County, Harris, Houston, Harris County, and then also we're going to be talking about measles vaccine in general. Okay, so let's begin. Remember that if you have any questions, you can drop them in the chat and then I'm going to be able to answer them at this time. Okay, if not, we can get back to them next Thursday. So thank you so much for joining. So let's start talking about the United States data. And this is basically as of May 15th. So they're actually like updating this data like every Friday. Now in the United States, we have a total of 1,024 confirmed cases, most of them including diverse age ranges, including mostly 30% children of under 5 years of age. Also, it's very important to know that most of these cases, they mostly belong to patients who has been unvaccinated or maybe their vaccine status is just unknown. Here in this slide, we have basically Texas. Texas is leading in for not a good reason, actually. We're seeing that most of these cases, they started in the west side of Texas, and then it had been spreading throughout the state lately. Right now, we have reported, and this is as of today. So this report was basically from this morning at 10 a.m. We have 722 cases. This is actually four more cases than from May 16. Okay, if you could see right there, we're seeing that the ground zero for this outbreak, it started within actually Gaines County, which is that orange rectangle right there on the west side. Also, we can see that actually cases are being spreading throughout the entire west area, but also we're seeing a few of sparse cases within the north area and now being reported within the mid Texas region. But what's going on in our area, in Houston, Harris County? The good news is that we don't have any active confirmed cases. Actually, we had reported three cases. And something that I forgot to mention earlier, but it's important to know, is that in the United States, we have had three dead cases. Most of these are actually children, basically from scholar ages. But from these three cases, two of them, they belong to Texas, and then the other case belongs to New Mexico. So today, actually, we're going to be talking about the vaccines in general, okay, how the vaccine works, what type of vaccines we're going to encounter. Remember that in terms of measles is a 100% preventable disease, and the reason is because we have vaccines available. The vaccine that is given for measles, it's actually included in the MMR vaccines, which is measles, mumps, and rubella. So in other words, this only is not going to be only preventing for measles, also for mumps and rubella as well. Also, we have another one that contains varicella. And in general, remember that these vaccines, they should be given actually at the year or actually 12 months old to 15 months old of age. And then it should be repeated or reinforced with a second dose at the age of 4 to 6. But now, because we have an outbreak, it's important to know that we can still give the vaccine to children that they are actually weaving or actually older than 6 months old. And the reason to this is because of the immune component coming from the mother. But according to the vaccine types, we're going to see diverse different types of vaccines, including those that are coming from bacteria, viruses, or even toxins. Okay, the one for measles is actually a live attenuated virus. So what that means is that with technology of RNA recombinant, basically in the lab, basically the lab is able to kind of produce the antigen or the virus that is actually weakened. Okay, but not only that, we're going to see that depending on the infection, it's going to be actually that antigen that is actually produce. Okay, but how vaccines works? Okay, so here it's very important. Remember that knowledge is power. So basically, once a person it gets vaccinated, we're gonna see that in this case with measles, the live attenuated virus is actually inserted into the intramuscularly, and then actually it could still spread through the entire body, generating an immune response. So how this works? So basically, once this vaccine is given, we're going to see activation of the immune system, and typically of the white blood cells. So the white blood cells, there's like a diverse diverse reactions within it, but we're going to see that the white blood cells, specifically the B cells, are the one responsible to produce the antibodies. So as you could see in this image, those white-like structures that you see right there, those are those antibodies. So what that means is that when the person it gets exposed to the measles virus in the future, basically that antibody is readily there, and then it's able to kind of destroy and also neutralize the virus. In other words, avoiding that person from getting the infection. Okay, and that's basically something very important about vaccines in general. Okay, but we're going to see also that in the last capsule, when we were talking, that was like last Thursday, we were talking about some myths, etc. And one of the concerns, or the biggest concerns in the population, is actually that vaccines, they could produce side effects, or maybe they could lead to other conditions such as an autism or maybe cancers or things like that. But remember that these are just myths. Okay, so these vaccines, they have been highly proven in a lab setting, and then they have been tested probably in animals, etc. And then once they are released into the community, we're going to see that they're very, very safe. Okay. In the case of the MMR vaccine, okay, remember that this one was actually produced, or it was actually, or it came to the market in the 1960s. But the thing about this is that that very first vaccine that we had, it was actually an on live virus, okay, and it didn't work, so then it had to be changed to live attenuated viruses. And then therefore over the time, it was demonstrated that people, they needed at least 2 doses, because 1 dose of that MMR can give basically a protection of 93%, and then 2 doses, it can give 97% of that protection. Okay, remember, vaccines are safer, and they're basically able to help us and actually to get healthy and prevent these infections. But now there's a lot of questions. For example, when you take your children or you take your kids for vaccinations, I know that there's a lot of mothers or parents that they're a little bit of afraid of those side effects that these vaccines might be producing. But remember, because we're actually inserting in the body or administrating in the body an antigen, the body typically or naturally is going to generate actually an immune response, and this immune response is going to be producing some sort of little or mild side effects. And when I'm saying this, is probably a low fever, or maybe like pain or redness on the side of the injection, but no more than that. And this typically can be actually solved with a little bit of Tylenol or something like that. Okay, but remember that there are also questions sometimes on how or when you're going to be taking your kids for vaccination. And a lot of times we came across with these parents that they say, oh, I just missed the appointment because my child, he was sick, maybe he had a fever, or maybe he was coughing or sneezing. So the good news is that we can still give the vaccine, or we can still administer that vaccine, even if there's a low fever, even if there's flu-like symptoms, even if the child has like allergy symptoms like sneezing or coughing, or having probably like nasal congestion or even ear infection. Okay, so as long as these symptoms are mild, vaccines are actually safer to give to them. Okay, remember that vaccines, and now in these days that we're seeing these outbreaks with measles, of that infection that actually it was eradicated, or it was declared eliminated in the year of 2000, now we're seeing these rise in cases for diverse reasons. Okay. All right, guys. So we just had a little bit of technical issues, and I know we were basically to the end of the video. Thank you so much for your patience and holding up right there about this very important topic. So I'm not gonna like kind of. I'm just gonna kind of summarize what we just have spoke about, and then we're gonna go over the last segment. Okay. Remember, we were talking about the data as of today, May 15, 1,024 cases. Texas leading. Actually, we have 722 cases. These are actually four more than the last Friday. And then we can see how the West area is still having those, spread of the infection across. And then we're seeing new cases, confirmed cases in the North area. We were talking also about the vaccine types. We were talking about, for example, how MMR vaccine, which is a live attenuated virus, how it works in our bodies. And remember that we also mentioned that the immune system, because it gets like an antigen, we're going to see the production of antibodies at the end of the day. And these antibodies, what they do is that they, once the person is exposed to the antigen, we're going to see that the person is going to be, or the person's body is going to be able to actually attack and neutralize the virus, stopping the infection. We also discussed about, for example, if when you can take your children for vaccination, even that there are some things that some people believe that maybe because there's low fever or maybe some flu-like symptoms that could be like a contraindication. And the theory is that it's not a contraindication to give the vaccine. And lastly, we were going to talk about how measles vaccines work. What do we need to know? Remember that when you take your child for vaccination, or maybe if you're an adult, you can go for that vaccination. And the first thing probably your doctor, your provider is going to ask you if you have been vaccinated in the past. Maybe if you're coming from another country, maybe you can bring with you that vaccination card that you can provide as evidence to support that. If not, if you're from United States or from the Texas region, we can still have ways to find out if you were vaccinated or not. And then if you were not, for sure, your provider is going to give you those doses needed. Okay. Also, it's very important to know your status and to have this, evidence with you, this vaccination card, because if your children or if your kid is entering school, or maybe it's going into a camp, or maybe it's traveling, this vaccination card might be requested, and then this would serve as an evidence. Okay. And mostly if you're traveling to areas that are endemic, or actually are having like a rising cases right now, like X is actually West Texas. Okay. So if you don't have any questions, that will be everything for today. Once again, thank you so much for your patience. And remember that we had these small technical difficulties, but we're here always to help. Remember that health is prevention. We will see you next time, next Thursday. Thank you so much.